to get through this challenge, and we will get through this challenge. Remember, for most of us, this will be an inconvenience. For those who actually do contract the virus, it will be a minor illness similar to the flu for most. But for some who are either elderly or otherwise medically fragile or very young and weak, it could be a serious or even fatal disease. And that has been our focus up to this point. That is to avoid spreading this virus to our most susceptible citizens. As we have watched the spread of the virus through the state last week, health and emergency officials at the local and state level have begun to stress even more the need for people to take efforts that would slow the spread of the virus and to avoid contracting the virus. So today, we must not see today's confirmed cases as a time to raise the level of concern or worry, but rather to confirm what we already knew was going to happen and to continue our efforts to minimize the impact. We have unnecessary exposure to the virus and to avoid contracting the virus. So keep doing what you're doing, because we know that it's working and working well. That is to continue with social distancing. Don't stand too close to other people. Avoid large crowds whenever you can. Wash your hands thoroughly and frequently with soap and water for 30 seconds or so at a time. Cover your mouth when you cough. Cough into your elbow or sneeze into your elbow, and then afterwards wash your hands, and keep your hands away from your mouth, nose, and eyes. To follow someone who has the virus, who has recently sneezed into their hand and opened a doorknob, and you unknowingly come right behind and open the same doorknob, the virus is on your hand. Only if you take it to your mouth, nose, and eyes are you kind of self-inoculating. So use these common sense measures to wash your hands regularly and practice social distancing. Don't greet people in this day and age now by shaking hands, but rather touch elbows or nod your head and speak. Recognize the symptoms of COVID-19, which are fever, cough, and a shortness of breath. And if you think you are having those symptoms, for Pete's sake, stay home. Self-quarantine yourself and monitor your progress. Talk with your primary physician or healthcare provider if you have concerns or feel ill, but do not show up at the emergency room unannounced. That's the worst thing that you can do, because you then run the risk of spreading that infection to everyone. To slow the spread of the virus, government, schools, large events, and businesses have all reviewed their operations and begun partial closures or alternative service delivery models to slow down or minimize interaction of individuals, and especially groups that are larger than 10 people. They are doing this while maintaining a level of service that our public relies on each and every day. And I especially want to thank our medical providers, not just Navicent and Coliseum, but also individual doctors' offices and facilities like First Choice Primary Care and the Macon Volunteer Clinic, who are stepping up and providing accurate and timely information to patients. And we can provide phone numbers for those organizations as well, so that you can call and get additional information. Want to thank everyone for making difficult decisions and for making alternate plans to help support our community while we work to slow the spread of the virus. Each and every day, teams from across the community are identifying other ways that we can slow the spread and support each other while we do that. Thus far, let me recap some of the steps that we as your local government have taken. We have closed our recreation centers, and the Centerplex has canceled several highly anticipated concerts and events. Our court systems have rescheduled trials and arraignments and have made limited public access, or have limited public access to their offices, instead asking people to utilize online services and information. Schools, as you know, have suspended classes, and parents are now at home figuring out how to work from home while teaching and caring for their children. The school district, much to their credit, in a very short time has built an entire e-learning system that will help parents teach and allow teachers to provide ongoing support. The library system on this year's Cherry Blossom Festival, it's been canceled, a sad day for so many families locally and for thousands of people who travel here each year to enjoy our hospitality. Our colleges and universities here in Macon-Bibb County have suspended classes and moved to online learning, just as they have across the state and nation. Businesses have moved to online sales and curbside pickup only, and they are hurting as more and more people stay home and avoid eating out. The Macon Water Authority has taken steps to ensure that families have access to water for household use, and especially to wash their hands regularly. And today the Transit Authority announced a 10-point plan of additional measures that they are taking to continue to provide essential transportation services, but limiting the spread of the virus, and so much more. Our hospitals, Navicent and Coliseum, have taken extraordinary measures to ramp up their capacity and capabilities, and we are indebted to both Coliseum and Navicent Health for all that they are doing to protect citizens of Middle Georgia. I truly believe, and this comes from talking with our health officials, that the steps we have taken as a community have had a major impact on our first confirmation being today rather than days or weeks ago. We have managed to blunt the curve and to slow the spread of this virus, and that is commendable. However, we know that the state continues to conduct tests, and I'm sure there will be more confirmed cases in our county, region, and state. It's just the reality that we're in right now. But we must not only continue with our efforts, but we must again do this with an understanding that we should not panic. We should avoid unnecessary contact and avoid hoarding or buying merchandise out of proportion with what you need. Our transportation system continues and logistics systems continue, and shelves will be restocked. You don't need to about a month's worth of toilet tissue at one time. So last week, what we're doing here as far as the Macon County government is concerned, we've asked our department heads to begin planning for what alternative work schedules would look like for your consolidated government, with a focus on protecting public safety, maintaining services, protecting health of our employees and our community, while finding ways to support employees whose home situations have changed. And we want to work with our employees and show them the same compassion and concern that we have for friends and neighbors. We're looking at how people can either work from home or implement alternate hour schedule, day schedules in those departments that cannot work from home, and promote social distancing while providing needed services. We've got to continue to patrol the streets. We'll be announcing them so that people are aware of how they could be affected. And we ask for people's patience. In these uncertain times and when things are changing, frustration is likely to happen. And we want to urge and encourage people to be patient, to be kind and considerate, and look out for your neighbor. As you work to maintain some sense of order in your own household, be cognizant and aware of elderly neighbors who may be down the street. Reach out to them with a phone call and ask them if they need anything that you could pick up for them, if they are among the fragile population who ought to avoid exposure to crowds and the public in general. I know that in Macon-Bibb County and in Middle Georgia, we have come together with a plan that's been developed by experts, that's continuing to be modified and amended as necessary, so that we do our part to keep services going while looking out for the health and minimizing the risk of this COVID-19 infection. And I want to thank each and every one of you who has tuned in today or who may see this later in a newscast. I want to thank you for your patience, for your willingness to comply with common sense requests and instructions, that you postpone or avoid unnecessary public exposure, maintain social distancing and protocol for limiting your contact with and the possibility that you could contract this virus. So we urge you today to get additional information if you need it. There are several wonderful websites that you can access. Macon Volunteer Clinic has a wonderful website with a lot of information about COVID-19 and precautions and things that you could be aware of. One last request from me, and that is, do not please call 911 except in cases of real and actual emergency, a fire, a life safety event that needs the immediate attention of the sheriff's department. Instead, rather than calling 911, call the non-emergency number, which is 751-7500, and people will answer that phone and try to provide you with the assistance that you might need, but avoid clogging up 911 with unnecessary calls, please. We appreciate this, and at this point, I'll be glad to answer any.
Yes, sir. Yesterday there was one restaurant in town advertising a Stop the Hype special, asking people to come in.
we have not considered that up to this point, Grant. We think instead that by encouraging people, encouraging individuals, be they patrons or be they owners of establishments, to take steps that are appropriate for them and their clientele, or if you're a patient. So rather than a curfew, we are again recommending that people use these social distancing measures and avoid unnecessary contact with crowds. You can still do that while supporting businesses and specials, especially for takeout. I know restaurants would appreciate your calling ahead and placing an order, and they'll bring it out to the curbside to you. As far as going out to bars and this, that, or the other, again, the kind of the magic working number is don't get in a crowd of more than 10 people, and keep a distance between you and other patrons. So if you feel like you just need to go in and have a drink and relax, I'm not going to say that you can't do that, but don't sit right next to somebody you don't know would be my suggestion. And individual awareness and responsibility continue to be my theme. Tanya.
Is there anything you feel as though that we're not prepared for, like medical supplies or?
No, at this point, I want to say to both of our hospitals who have been working diligently to prepare for this and to acquire additional equipment, personal protection equipment, ventilators, etc. They are making preparations that I feel are going to be adequate. Because they know better than I their capacities and their needs, and I know that they are working diligently on our behalf. So I'm not aware of any critical shortage of medicine or equipment at this point. It's going to be nothing but an inconvenience. For some who actually contract the virus, it's going to be a minor illness similar to the flu. And only for those who are elderly or medically fragile or very, very young and weak might this be a life-threatening condition. So keep that in mind. Be patient, work with others and work with your neighbors. And if there are service disruptions or delays, be a little understanding. We'll get through this by working together. Thank you.